Hi everybody, this is Dr. Lou Walters at the Source Wellness Center. We offer an initial meet and greet or consultation with patients. Some patients like to have that before they schedule a new patient appointment. And what happens in that, as well as if we don't do that at the first appointment, is we're both kind of determining whether this is a good fit or not. So for the patient, they're typically asking me questions about what my approach is to healthcare and seeing if that's what they're looking for, and my personality and whatnot. And then I'm also, when I'm talking with them, first thing I'm looking at is, do I think I can help this person? And then two, is the approach they're looking for, is that the way that I practice medicine or not? And if it isn't, then I typically will refer them to somebody I think is a better fit. So what is my approach and what am I exactly looking for? So if you think of a river that's been polluted, this is typically where most people come to the doctor, is when they're having signs and symptoms or they have a disease name. And this actually isn't healthcare, it's sick care, because we don't do anything until we get sick. So if somebody is just looking to take a pill for their symptom, often that is the case. Now they'll come to a naturopathic doctor because they want something natural. They want a green pill instead of a white pill to manage their symptoms. And in those cases, even though I certainly think I could help them, I often will refer them to somebody else because that's not the level that I like to work at. I want to figure out, why are you having these problems in the first place? There are triggers. There are sources of pollution, whether they're physical, something in your eating or in your habits, but something is irritating your symptoms and your system, and we need to identify that and get that out. And then we need to clean up and rebalance and restore your system and all the different organ systems and make sure they're working properly. We need to reset mental emotional patterns. And then we need to go back even further, ideally, to figure out why we have these triggers. Why do we have these susceptibilities? Where did they come from in the first place, and restore that? Now, this definitely does take more effort and time than just taking a green pill instead of a white pill for a symptom, but we're restoring optimal function and health so that the person can be more resilient, that they can experience different stresses that don't set them off or throw their system off. They're less likely to develop other conditions, and they aren't just constantly avoiding triggers or taking something to manage a symptom. And then the other thing that I look for is, do these people value their overall health and their healthcare? Are they going to work towards it on a regular basis? I like to work with people even after we get them feeling and to the level of health they want to be, we work together to keep them there. And that's actually what healthcare is not just going to the doctor when you're sick, but coming in when you're feeling great to do everything we can to keep you feeling great. They realize that health is not a destination, it's a journey, it's an ongoing process, that it's something we have to work at as long as we're alive so we have a more enjoyable life and a longer life. So those are the things that I look for, and those are the people that I like to work with. Now, if somebody's at a different level and we determine that either in the consultation or the first appointment, then I will refer them to another doctor. There's not a wrong, it's just what level are we working at. If you feel that what I described is what you're looking for and you would like to see if you'd want to work with me, feel free to go to the website, thesourcewellnesscenter.com, and you can schedule a meet and greet or a consultation. Hope you find that helpful. Best wishes, and be healthy.